Hey, thank you for stopping by the NAHQ Team Training Solutions information session. My name is Scott Woodard. I am the Director of Team Training and Workforce Solutions here at the National Association for Healthcare Quality, better known as NAHQ around the world. For the next few moments, I'd like to share with you some detailed information on our team training solutions and some of our CPHQ resources. But before I do that, I realize that many of you will know NAHQ very well. But some of you, this is literally a first-time introduction. So to help you, I'd like to kind of level set and kind of lay some fresh understanding of who we are, what we're about, and provide you some insight into the team training solutions that we offer that are all rooted in the healthcare quality competency framework. NAHQ is the only organization dedicated to advancing the profession of healthcare quality and quality professionals, those that find themselves doing the work of quality. For over 45 years, we have experienced servicing quality professionals and organizations and institutions. NAHQ literally represents thousands of individuals and members and those who carry the only accredited certification for healthcare quality professionals, the gold standard CPHQ. Our members and our CPHQs work across the continuum of care. Oftentimes we find that they hold titles of Chief Quality Officer, VP, Director, Manager, but we also work with those who are new to quality or in quality expanding roles or quality curious or even quality adjacent. Sometimes they're not always a part of the quality team, but they do impact quality outcomes. We have literally upskilled and certified tens of thousands of individuals across the United States and around the world. Every day at NAHQ, we get up with the mission of impacting healthcare quality. We believe that workforce readiness is the key to delivering on quality. And to reduce variability in healthcare delivery, we are convinced that you first must reduce variability in healthcare quality competencies. We do this through offering turnkey solutions to quality teams and quality professionals across the organization through competency development, professional assessments, thought leadership, and by offering standardized training and certifications. When we look at education for quality professionals and we look at quality training and for other individuals across healthcare, whether it be physicians or clinicians, we recognize that many times their pathways are very clear, very linear, very worn. If I'm going to be a nurse, I'm going to be an RN or a BSN or an MSN or get my DMP. Or maybe I'm looking at medical school and I'm looking at licensure and fellowship and specialty and boards and credentialing. My pathway for growth is very clear. But we have found that for quality professionals, that has not been the case. Many times it's been very varied. There's oftentimes been no standard. There's been no clear educational pathway. There's been no tried and true job descriptions. And therefore, there's literally been no playbook. Many times quality has been developed at a local level on the fly. And we have found that it's often not been in place. And many individuals end up in quality because they were good at something else. We believe to reduce variability in healthcare, you first have to reduce the variability in healthcare quality competencies. We all know that standardization is the key to improving quality. So NAHQ, we recognize this problem and we went out to solve it. And we went out and developed the quality competency framework that has now been validated not once, but twice in the market by those who do the work and those who are leading it. This framework provides for the first time a set of industry standard quality competencies and related skill statements. In its fullest expression and in all its detail, the framework provides for the first time a list of all the things that must be present in a high functioning quality program. It literally takes the guesswork out of quality and it pinpoints upskilling opportunities. Our framework goes so far to have rigorously developed 8 dimensions, 29 competencies, 486 skill statements that help organizations and individual contributors take the necessary steps towards increasing their own proficiency in healthcare quality. We recognized that we needed to align with the organizations and to help organizations and quality leaders support their quality mission and to help them upskill their entire workforce to the fundamentals and the skills needed for healthcare quality. We went out and aligned a suite of team training solutions and group CPHQ certification opportunities that were all rooted in that quality competency framework. And we provided them to help support all levels of the organization, from frontline clinical to your quality professionals, to quality leaders, quality executives, to even your subject matter experts. We developed 3 levels for across the organization. If you can think of a pool, kind of the shallow end to the deep end. We first had our HQ concepts, which is really designed for everyone within the organization. It's designed to provide an introduction to healthcare quality and safety, really for that frontline staff. And then we put in place HQ principles, really designed for those quality professionals to lay the fundamentals of healthcare quality and patient safety for those professionals. And then, of course, the gold standard CPHQ certification for your quality teams, your leaders, your executives, and your subject matter experts. Let's take a second and look at those in just a little bit more detail. Your HQ concepts, that introduction, it's a 60-minute asynchronous scenario-based training that provides relatable, digestible story of medical error through 7 modules. It's geared really predominantly toward that front line and those patient-facing staff and even their leaders. But we've seen organizations use this for their administration staff, for their executives, and even their board members. It's really designed to teach the basics and techniques for your employees to complete a cycle of improvement and implement sustainable change in processes. It's designed to help your frontline have the tools necessary to support the quality mission and introduce the entire workforce to the fundamentals in healthcare quality. It's rooted in that quality competency framework, so it creates a standard, shared vocabulary, reduces the time and the effort to build interdisciplinary teams and sustain initiatives. This story-based scenario is that we like to provide. It brings things like systems thinking and root cause analysis and rapid cycle improvement, PDSA process, and looks at just culture. It looks into items and objectives like recognizing your role in the quality services, really understanding the fundamentals of healthcare quality, the tools, the resources for PI, understanding teamwork that's needed for quality outcomes, the link between patient safety and healthcare quality, and even identifying processes and methodologies, recognizing the data to make decisions and tools and practices. This 1-hour module, really designed as a volume-based pricing scale and setup, is designed to support the team, but really designed to support system-wide adoption. Many of our systems and organizations use this like a once-a-year annual training, like an HR training or a sexual harassment training, so that it begins to lay the foundation of quality across the organization and every member of the team. HQ Principles. This is a 5-hour asynchronous certificate program. It deep dives for your quality professional. It's designed to lay the foundation of quality and patient safety fundamentals and methodologies for those professionals. Really looks at 6 different modules to help expand their knowledge and really integrate quality into practical settings. It's really ideal for those that are new to healthcare quality or those that are quality adjacent. Ideal for those with expanding quality roles or quality leaders and teams. Comes with resources that you can see here kind of in the slide. A pre-test, a post-test, a pre-assessment, a self-assessment, a post-assessment. Looks in the different 6 modules. So you see everything from the evolution of healthcare all the way through the principles and quality improvement and patient safety, using that data to make decisions, quality improvement processes, putting it together as a team, provides them resource guides, 3 case studies, and upon an 80% completion, a certificate of completion that can even be used on a resume. 5.75 CPHQ or C&E hours. And you'll notice there on the right, it really deep dives into those quality improvement tools and the data visualization tools. This resource, HQ Principles, upon completion, is really designed to provide a standard vocabulary, level set your team's understanding, and provide a toolkit among everyone on the team and everyone that's involved in delivering quality, safety, and value. And last of all, was our well-known gold standard CPHQ. The CPHQ, there's more than 13,000 professionals that currently carry that credential. It's the only accredited certification for healthcare quality professionals accredited by the NCCA. And we have found that research confirms that CPHQ compared to non-CPHQ is notable. CPHQs work at higher levels compared to non-CPHQs across all 8 domains of the healthcare quality competency framework. We recognize that more than half of job postings for healthcare quality or related leadership roles currently through the NAHQ Career Center just over the past 12 months either require or strongly prefer CPHQs. CPHQs tend to occupy the highest job levels in quality, director, executive director, vice president, and above, more often than what we see with non-CPHQ colleagues. And a higher proportion of CPHQs report working at across 6 or 7 of the domains of healthcare quality compared to just 3 or 4 of those domains for non-CPHQs. This gold standard credential, highly recognized within the market, is accessible to you and to your team and to your organization. We've put together some CPHQ group training packages that can either be self-study, they can be live instructor-led, whether it's through a public virtual course with over 16 hours of content, HQ Solutions textbooks, pre-test, and that allows them to kind of look into actual test questions and prep for that exam, all the way through NAHQ annual membership to the CPHQ exam itself. Those resources offered, or an individual can do self-study, and they have 12 months of access to those resources before they sit for that exam. We can actually take a team through a public course where they have live access to those instructor-led virtual courses, including the self-study resources to support them when that training and that course is over. Or if you have 25 or more individuals, we're more than happy to do a private course for you and your organization and provide that CPHQ live course instruction specifically just for your cohort and for your group of employees. So whether it's the HQ concepts, whether it's the HQ principles, or the CPHQ, all grounded and rooted in that healthcare quality competency framework, we are pleased and prepared to support you. These are just a few of the brands and some of the organizations that we work with on a regular basis across the continuum of care. And we look forward to meeting you, and we look forward to supporting you and your organization. If you have any questions, or you would like to learn some additional information on any of these training resources, just a few steps to take. Maybe you would like a demo of one of the products. We'd be more than happy to provide you a demo. Maybe you would like to request some pricing or proposal on what would it take to put your team or organization through those resources. These are some of the things that we can provide for you. Maybe you'd like to just discuss your organization's needs and see how NAHQ's resources might align. If you have any of these questions, any of these needs, or any of the inquiries into these types of solutions, we're more than happy to help you. Feel free to email us at teamtraining@nahq.org. We look forward to meeting you. We look forward to seeing how that we can work together to support you and quality at your organization. Thank you.